Every 40 seconds, someone in America has a stroke. Every 4 minutes, someone dies from one. These numbers represent real people with families and stories. The scary truth is most stroke victims didn't recognize the warning signs until it was too late. But today, you'll learn how to spot these signs and potentially save a life, starting with the 5 most critical symptoms everyone should memorize. The first and most important thing to know is the FAST method developed by doctors to help ordinary people identify strokes quickly. F stands for face drooping, which you can check by asking the person to smile if one side of the face doesn't move as well as the other or looks uneven. That's a major warning sign. I spoke with a woman from Ohio who noticed her husband's smile looked strange one morning, but waited an hour before calling for help. That delay caused unnecessary damage that could have been prevented. A in FAST represents arm weakness, which you can test by having the person raise both arms straight out if one arm drifts downward or feels weak. That's another clear sign of stroke. This happens because the stroke affects the part of the brain controlling movement. A construction worker in Florida told me he ignored his arm numbness, thinking it was just a pinched nerve. By the time he sought help, he had lost significant movement that never fully returned. S stands for speech difficulty, where words may come out slurred or confused. Even simple sentences become hard to say properly. Many mistake this for tiredness or confusion, but it's actually one of the clearest stroke indicators. A grandmother in Texas shared how her family laughed when her speech became garbled. Thinking she was joking, their delay in calling 911 resulted in much worse outcomes than necessary. T is for time because every minute counts. During a stroke, brain cells die rapidly without oxygen, leading to permanent damage. If you notice any of these signs, call 911 immediately. Even if symptoms seem mild or come and go, emergency responders prefer false alarms over delayed treatment. The faster someone gets medical attention, the better their chances of recovery. Beyond FAST, there are 2 other critical signs. Many people miss sudden, severe dizziness or balance problems is one that often gets ignored. This isn't normal lightheadedness, but a profound loss of coordination that comes on abruptly. A nurse from Chicago described a patient who dismissed his dizziness as low blood sugar. By the time he realized something was wrong, he had fallen and suffered additional injuries. The second often overlooked symptom is a sudden extreme headache, unlike anything experienced before. Many stroke survivors describe it as the worst pain they've ever felt, coming on like thunder. This is particularly common with bleeding strokes, where a blood vessel bursts. A New York businessman recalled being in a meeting when such a headache struck. Thankfully, his coworker recognized the seriousness and called an ambulance immediately. Strokes can happen to anyone regardless of apparent health. While high blood pressure, diabetes, and smoking increase risk, about 1/3 of strokes occur without warning. This unpredictability makes knowing the signs even more crucial. Age is another factor, with risk doubling every decade after 55. But strokes can and do happen to younger people too, which is why everyone should learn these symptoms. Many stroke victims report experiencing mini strokes or TIAs before a major stroke. These temporary episodes show the same symptoms, but last only minutes to hours. Nearly half of people who experience TIAs will have a full stroke within a year. If untreated, recognizing these warning signs and seeking immediate medical attention could prevent catastrophic damage. A teacher from California shared how she had brief episodes of blurred vision and slurred speech for weeks before her major stroke. Had she recognized these as warnings, she might have avoided permanent disability. The time of day also matters, with strokes being most common in early morning hours. This is because blood pressure naturally rises in the morning, and blood is more likely to clot after hours of inactivity. Simple precautions like drinking water before bed and moving gently upon waking can help reduce this risk. A retired firefighter from Arizona told me he always keeps water by his bedside and does gentle stretches before getting up, habits he developed after his brother suffered a morning stroke. Diet plays a significant role in stroke prevention, with certain foods increasing or decreasing risk. The typical American diet, high in processed foods and salt, contributes to high blood pressure. The leading stroke risk factor, simple changes like reducing salt intake and eating more fruits and vegetables can make a big difference. A chef from Louisiana shared how changing his cooking style after his stroke not only helped his recovery but improved his whole family's health. Physical activity is another crucial factor for stroke prevention. Regular exercise helps maintain healthy blood pressure and circulation. You don't need intense workouts, as even gentle daily walks provide significant benefits. A bookstore owner from Oregon started walking with her dog every morning after her stroke. Scared 2 years later, her doctor said her stroke risk had decreased dramatically thanks to this simple habit. Stress is an often underestimated contributor to stroke risk. Chronic stress raises blood pressure and can lead to unhealthy coping mechanisms like smoking or overeating. Finding healthy ways to manage stress through meditation hobbies or social connections can significantly reduce risk. A Vietnam veteran from Iowa credits his weekly fishing trips with friends for helping him manage stress and avoid another stroke after his first scare. Smoking doubles stroke risk by damaging blood vessels and increasing clot formation. The good news is that stroke risk begins decreasing within months of quitting, regardless of age or smoking history. A grandfather from Michigan quit after 40 years when he learned his smoking could have caused his wife's stroke. 5 years later, tests showed his cardiovascular health had improved dramatically. Alcohol consumption presents a complicated relationship with stroke risk. While heavy drinking increases risk, moderate consumption might offer some protection. The key is moderation, defined as no more than 1 drink daily for women and 2 for men. A bartender from Nevada shared how cutting back his drinking helped lower his blood pressure enough that his doctor took him off medication. Atrial fibrillation, a type of irregular heartbeat, increases stroke risk. 5-fold, many people have this condition without knowing, making regular checkups. Important blood thinners can dramatically reduce risk for those diagnosed. A pianist from New York discovered she had atrial fibrillation during a routine physical thanks to early detection and treatment. She avoided what could have been a devastating stroke Diabetes significantly increases stroke risk by damaging blood vessels over time. Careful blood sugar management can help mitigate this risk. A school nurse from Pennsylvania makes sure to check her blood sugar regularly and follows her doctor's recommendations strictly since her diabetes diagnosis. She considers it a small price to pay to avoid her father's fate, who suffered multiple strokes. Family history plays a role but doesn't determine destiny. Even with genetic risk factors, lifestyle choices can dramatically influence outcomes. A mother of 3 from Georgia with a strong family history of strokes focuses on controlling what she can through diet, exercise, and regular medical checkups. Her proactive approach gives her confidence despite her genetic risk. Recognizing stroke symptoms is only half the battle. Acting quickly is equally important. Many people delay calling 911 because they doubt their judgment or hope symptoms will pass. Remember that stroke treatments work best when given quickly, with some being effective only within the first few hours. A taxi driver from Chicago regrets waiting to see if his symptoms would improve. That delay cost him full recovery. Emergency medical teams are trained to assess potential strokes rapidly when you call 911, describe the symptoms clearly, and say you suspect a stroke. This triggers specialized protocols that save precious time. A paramedic from Boston explained how even a minute's difference in response time can affect outcomes dramatically. They'd rather evaluate a false alarm than arrive too late. Hospitals have stroke teams ready to act the moment a patient arrives. Specialized scans can quickly determine the stroke type and guide treatment. Some patients qualify for clot-busting drugs or procedures that can stop strokes in progress. A stroke neurologist from California emphasized that these treatments weren't available decades ago, but now save countless lives when administered promptly. Rehabilitation begins immediately after emergency treatment. The brain has remarkable ability to rewire itself, especially with early therapy. A physical therapist from Texas shared inspiring stories of patients regaining abilities. Doctors said they'd lost forever. The common factor in these success stories was starting rehabilitation as soon as medically possible. Support systems play a crucial role in recovery. Stroke survivors with strong family support tend to fare better. A social worker from Florida organizes support groups where survivors and caregivers share resources and encouragement. She's seen firsthand how community aids recovery in ways medicine alone cannot. Preventing another stroke becomes the focus after recovery. Doctors address underlying causes and recommend lifestyle changes. A nutritionist from Oregon works with stroke survivors to develop sustainable eating habits. She emphasizes small, consistent changes over restrictive diets that often fail. Technology offers new hope for stroke survivors, from apps that aid speech therapy to devices that assist movement. An engineer from Colorado developed a glove that helps his father regain hand function after his stroke. Such innovations are transforming recovery possibilities. Research continues to improve stroke treatment and prevention. Clinical trials test new medications and procedures regularly. A researcher from Massachusetts explained how each advancement builds on the last, creating cumulative progress that's reduced stroke deaths by over 30 in recent decades. Education remains our most powerful tool against stroke. The more people know the signs, the more lives we can save. A teacher from Washington started a stroke awareness program at her school. After her husband's stroke, her students have already identified 2 cases in their families, thanks to what they learned. Your actions today could save a life tomorrow, whether it's learning these signs, sharing them with loved ones, or making healthy lifestyle changes. A retired doctor from Virginia makes it his mission to teach stroke recognition at community centers. He estimates this simple act has prevented at least 12 strokes in his town. The second part will continue with detailed information about what to do when you recognize these signs, including step-by-step instructions for responding to a potential stroke and how to prepare yourself and your home for such emergencies. Now that you know how to recognize a stroke, let's talk about exactly what to do when those warning signs appear, because hesitation can cost lives. The first and most important step is calling 911 immediately. Don't wait to see if symptoms improve or try to drive the person to the hospital. Your self-emergency medical services can begin life-saving treatment the moment they arrive. A paramedic from New York explained how they can perform critical assessments during transport that save precious minutes. Remember that some stroke treatments only work if given within the first 3 to 4 hours after symptoms begin. While waiting for help to arrive, there are several things you can do to assist the stroke victim. First, keep the person calm and seated or lying down with their head slightly elevated. Don't give them anything to eat or drink, as swallowing may be impaired, which could cause choking. Loosen any tight clothing around the neck that might restrict breathing. If they're unconscious, carefully roll them onto their side in case they vomit. A nurse from Chicago shared how this simple action prevented aspiration in one of her patients. Note the exact time when symptoms first appeared, as this information is crucial for doctors making treatment decisions. It's equally important to know what not to do during a stroke emergency. Never try to give the person aspirin or any other medication unless specifically instructed by emergency personnel. While aspirin can help with certain types of strokes, it can worsen others. Don't insist the person walk or move around, as this could cause falls or further injury. Avoid arguing with the person if they're confused or denying there's a problem. A stroke survivor from Texas recounted how his wife saved his life by calling 911, despite his protests that he was fine if the symptoms disappear. After a few minutes, still seek immediate medical attention, as this could be a transient ischemic attack or warning stroke that often precedes a major stroke. After the immediate emergency passes, there's still critical work to be done. Hospitals will run tests like CT scans or MRIs to determine the stroke type and extent of damage. For ischemic strokes caused by clots, doctors may administer clot-busting drugs or perform mechanical thrombectomy to remove the blockage. Hemorrhagic strokes caused by bleeding may require surgery to repair blood vessels. A neurosurgeon from California emphasized how treatment has advanced dramatically in recent years, with new techniques saving brains that would have been permanently damaged a decade ago. Rehabilitation should begin as soon as the patient is medically stable. This typically involves a team of specialists, including physical therapists, occupational therapists, and speech therapists. The first weeks and months after a stroke are crucial for recovery as the brain demonstrates remarkable neuroplasticity. A physical therapist from Florida shared inspiring stories of patients regaining movement through consistent, repetitive exercises, even years after their strokes. Modern rehabilitation often incorporates technology like virtual reality and robotic devices that help rewire neural pathways. Family members play a vital role during recovery, learning how to assist with exercises and daily activities without creating unnecessary dependence. A caregiver support group leader from Ohio explained the delicate balance between helping and enabling. Simple home modifications like grab bars in bathrooms or removing trip hazards can make a big difference in safety speech. Therapists often work with families to develop effective communication strategies. When language skills are affected, patience and encouragement are key, as recovery can be frustratingly slow with good days and bad days. Preventing another stroke becomes the primary focus after recovery. Doctors will address underlying conditions like high blood pressure, atrial fibrillation, or diabetes that contributed to the first stroke. Medications may include blood thinners, cholesterol drugs, or blood pressure controllers that must be taken exactly as prescribed. A pharmacist from Pennsylvania stressed the importance of medication adherence, sharing how one patient's second stroke resulted from skipping doses to avoid side effects. Regular follow-up appointments, monitor progress, and adjust treatments as needed. Lifestyle changes significantly reduce the risk of recurrent strokes. Quitting smoking is perhaps the single most effective change, as tobacco damages blood vessels and increases clotting. Dietary modifications like reducing salt and increasing fruits, vegetables, and whole grains help control blood pressure and cholesterol. A nutritionist from Louisiana developed simple, Southern-inspired healthy recipes that made the transition easier for her stroke patients. Even modest weight loss of 5 to 10 can dramatically improve cardiovascular health for overweight individuals. Physical activity tailored to individual capabilities strengthens the cardiovascular system and improves overall health. A cardiac rehab specialist from Colorado recommends starting with just 10 minutes of walking daily and gradually increasing as tolerated. Water aerobics or chair exercises work well for those with balance issues or weakness. The key is consistency rather than intensity, with the goal of reaching 150 minutes of moderate activity. Weekly, many community centers and hospitals offer specialized exercise programs for stroke survivors. Mental health deserves equal attention during recovery. Depression affects nearly 1/3 of stroke survivors, but often goes untreated. Counseling and support groups help process the emotional trauma of suddenly losing abilities. A psychologist from Michigan incorporates mindfulness techniques that help patients cope with frustration and anxiety. Cognitive challenges like puzzles, reading, or learning new skills stimulate brain recovery. Some patients find creative outlets like painting or music therapy particularly healing for both mind and spirit. Social connections powerfully influence recovery outcomes. Isolation can hinder progress, while strong support networks encourage rehabilitation efforts. Community programs like stroke clubs or adaptive sports leagues provide camaraderie and motivation. A social worker from Oregon organizes monthly outings where stroke survivors practice real-world skills in supportive environments. Technology like video calls helps maintain connections for those with mobility challenges. Pets can also provide therapeutic companionship and motivation to move. Financial and legal preparations are practical considerations. Many overlooked stroke survivors may need to complete advanced directives or modify power of attorney arrangements. Occupational therapists often help patients explore workplace accommodations or alternative career options if needed. A financial planner from New Jersey specializes in helping stroke survivors navigate insurance, disability benefits, and medical expenses. Proactive planning reduces stress that could otherwise hinder recovery. Caregivers must remember to care for themselves too. The physical and emotional demands of supporting a stroke survivor can lead to burnout. Respite care services provide temporary relief, allowing caregivers to recharge. A nurse from Georgia started a caregiver wellness program after her own experience helping her husband recover. Simple self-care practices like regular sleep, healthy meals, and brief breaks make caregivers more effective in the long run. Technology continues to revolutionize stroke recovery. Smartphone apps now provide medication reminders, speech exercises, and movement tracking. Wearable devices monitor vital signs and detect potential complications. A biomedical engineer from California developed a glove that helps his father regain hand function through gamified exercises. Virtual reality systems make repetitive rehabilitation exercises more engaging. Telemedicine allows specialists to consult with patients in remote areas. Research offers hope for future breakthroughs. Stem cell trials explore possibilities for repairing damaged brain tissue. New blood-thinning medications provide protection with fewer side effects. Advanced imaging techniques help identify stroke risks before catastrophe strikes. A researcher from Massachusetts explained how artificial intelligence now helps predict which patients are most likely to benefit from specific treatments. Participation in clinical trials gives some patients access to cutting-edge therapies while advancing medical knowledge. Community education remains essential for reducing stroke's toll. Knowing the signs and acting fast saves brains and lives. Schools, workplaces, and senior centers increasingly include stroke awareness in their health programs. A teacher from Washington started training students as young as 10 to recognize stroke signs. After her father's stroke, these students have since identified several cases in their families and communities. Everyone can contribute by sharing this knowledge with their networks. Your actions create ripples that extend far beyond yourself. By learning these signs and sharing them, you become part of a chain of survival. A retired fire captain from Arizona now volunteers teaching stroke preparedness, saying it's the most important work he's ever done. Simple preparations like keeping a list of medications and emergency contacts by the phone can save critical minutes during a crisis together. We can reduce stroke's devastating impact one informed person at a time. The final part of this series will provide a comprehensive stroke prevention plan, including specific dietary recommendations, exercise routines, and stress management techniques tailored for older adults, along with resources for further education and support.